Professional responsibilities related to disasters, communicable diseases, bioterrorism, presented by Tiffany Moore, Mary Jo Reed, and Laquita Williams. Natural disasters are naturally occurring events that cause human suffering and demand more resources than are available in the community. Types of natural disasters include hurricanes, tsunamis, wildfires, and COVID-19. Nurses have an important role in the emergency management cycle. They are responsible to plan for and respond to natural and man-made disasters, as well as prevent large-scale events and minimize negative effects. The first step in the emergency management cycle is mitigation, also known as prevention. In this step, nurses play an active role in preventing disasters, such as increasing surveillance and strengthening public health resources, such as immunizations, isolation, and quarantine. The second stage of the emergency management plan is preparedness. In this stage, it is important for nurses to create an action plan and determine alternate methods of communication, highlighting evacuation routes, and creating a disaster kit. The third stage of the emergency management plan is response. In addition to the reference agencies, nurses are responsible for assessments throughout the span of the disaster, paying attention to how many people are affected, food and water available, and the injured or dead. The final stage of the emergency management plan is recovery. In this stage, nurses are responsible for making home visits and reassessing the health care needs of the affected population, as well as providing stress counseling and assessing for PTSD. Nurses play an important role in emergency preparedness through planning, community and consumer education, and direct care provided before, during, and after disasters. Prior to disaster striking, nurses play a vital role in anticipating the needs of the general population, arranging and opening shelter locations, and ensuring available supplies are ready. During the disaster, nurses are responsible for triaging patients, anticipating client needs, and promoting infection prevention, such as hand washing and social distancing. After disaster strike, nurses are responsible for ensuring that clients can transfer from the shelter back to their home safely, as well as providing mental health support. Disasters can lead to communicable diseases via respiratory infections caused by overcrowding, insect bites, contaminated food and water, and also skin infections and wounds. Risk of water and foodborne diseases are extremely high during disasters. Causes include polluted water sources and contamination of water during transport and storage. Risk for respiratory infection or diseases may increase due to overcrowding, poor ventilation, and poor nutrition, and in crowded shelters, specifically in cold weather. Risk for vector-borne diseases can be caused by standing water caused by floods creating a breeding site for mosquitoes. Overcrowding conditions in temporary shelter may increase mosquito bite frequencies and promote the transmission cycle. Risk for infections resulting from wound or injuries are often associated with crush injuries and contaminated wounds. Nurses play a vital role in preventing diseases. This can be done at 3 different levels: primary prevention, secondary prevention, and tertiary prevention. The main goal is to reduce the amount of infections as well as increase awareness to the general population. At the primary prevention level, nurses are responsible for educating the public regarding prevention of diseases and ways to eliminate risk factors of exposure, such as hand hygiene, universal precaution, proper food handling and storage, and the use of condoms. At the secondary prevention level, nurses are responsible for performing health screenings to assess for early detection of diseases, as well as contact tracing to notify individuals that have been exposed to the communicable disease. At the tertiary prevention level, the main goal is to decrease complications caused by the infectious disease, as well as monitor treatment compliance and identify clients that need community resources. The nurse is responsible for educating the public on the importance of immunizations. The nurse must also stay up to date on current schedules and appropriate precautions when administering them.
Communicable disease is defined as a transmissible disease that stems from an infection or pathogen originating from a human or animal host. Other common diseases that we have heard of are hepatitis B, malaria, hepatitis C, dengue fever, and tuberculosis, with hepatitis B being the #1 worldwide disease. Healthcare workers are the frontline caregivers for prevention, education, and protection for the public's health. The risks are weakened public health infrastructure, a financial strain with lack of funding and political support, a depleting workforce with too few nurses and doctors, and the media influencing pandemic fears. Waterborne sources are caused by poor sanitation situations and can cause cholera and typhoid fever outbreaks. Vector-borne are created from an animal, rodent, or insect source. Mosquitoes carry malaria and equine encephalitis, and they are able to transmit to humans, horses, and birds alike. The treatment for them depends on the host and the specific pathogen. Foodborne illnesses are usually mild and easily treatable. Overcrowding creates a breeding ground for measles, TB, diarrhea, and meningococcal diseases alike. Further disease prevention would include bed nets, condoms, abstinence, hand washing, insect repellents, pasteurization, and chlorination of water. Weakened immunity from cancer, HIV, COPD, diabetes, and heart disease make us susceptible to opportunistic pathogens. As a nurse, you need to know the current PPE protocol for proper protection and the complications on how one illness can lead to another, like how diarrhea can lead into dehydration and then into acute kidney injury. It is imperative to discover what pathogen initiated this disease process so that the treatment will destroy the invader. Prevention involves isolating a pathogen once it is detected to determine its transmission, and then reviewing your outcomes and evaluating were they the expected ones or do you need a different treatment. Stool samples are the most common specimens collected, but rectal swabs, urine, blood, and vomitus also may be collected and sent to the CDC per their guidelines. After collection of the samples, microscopic visualization and incubation of some organisms will confirm their existence, so treatment can be identified. Once the pathogen has been identified, then treatment can begin. No matter the type of illness, always remember to push fluids and good old chicken noodle soup. Know where your facility's command center is located, and the state of Florida has an emergency status system database that the hospital will report our resources, bed availability, and faculty status to. This website is for anyone who practices medicine, such as a chiropractor, veterinarian, lab technician, hospital, or clinic, but during normal business hours, contact your local Department of Health. This website, you can also report cholera, diphtheria, hepatitis A, and the plague as well. And diseases only have to be suspected, not confirmed. All medical records in any form are protected, but public health authorities are authorized by law to collect any information to aid them in protecting the health of the public. These agencies are authorized to collect this information, but there is a shareable limit, and privacy rules stipulate that a reasonable amount of information can be acquired to accomplish the intended purpose. The nurse's role when communicable diseases transition into bioterrorism will be knowing how to treat the diseases, keeping the public safe, knowing the protocols and the chain of command, and not allowing media hype to create panic.
Bioterrorism is the act of using biological agents, microbes, or toxins as weapons of mass destruction. There are three categories of biological agents, Category A being the most dangerous to Category C being potentially dangerous. Category A is high priority agents because it can be spread easily from person to person, resulting in high mortality rates. Category B is the second highest priority agent because it can be spread moderately easily and it has a low mortality rate. Category C is the third highest priority because it could possibly be engineered to cause mass destruction and have a high mortality rate. During an active attack, victims of the disaster are triaged into one of four categories: immediate, delayed, minimal, or expectant. Biological agents can have multiple routes of transmission, so knowing how it can be spread and what precautions to use are one of the important things to stop the spreading. Healthcare workers caring for patients on contact precautions should wear a gown and gloves for all interactions. Caring for patients on droplet precautions, healthcare workers should wear a surgical mask, gloves, shield, and a gown for all interactions. For airborne precautions, the same PPE should be worn as in droplet precautions, except The mask needs to be an N95 or higher level respirator, and the patient should be in a negative pressurized room. There are 3 levels of prevention: primary prevention, which is bioterrorism planning; secondary, which is early recognition; and third, which is rehabilitation of survivors. For bioterrorism planning, you want to prepare drills, vaccines, and ensure availability of antibiotics, design response plan, identify chain of command, define nursing roles, and set up protocols. During the early recognition level, you want to activate a response plan, implement infection control and containment measures, screen for exposure, educate the population, and monitor mortality and morbidity. During the rehabilitation of survivors level, you want to monitor medication regimens and referrals, and to evaluate the effectiveness and timeliness of the plan. The nurse needs to be well-rounded on the understanding of pre-disaster planning, knowing how to deliver proper care during a bioterrorism event, and knowing how to perform post-disaster evaluations. The nurse has many roles in a bioterrorism attack. They help with planning, detecting, controlling, and responding. During planning, the nurse must help write, update, and review the emergency plans, stay up to date on the education to better communicate accurate information, and conduct and practice drills. During detecting, the nurse will identify potential exposure to bioterrorism agents, determine the route of transmission, and will obtain and send biological and chemical specimens to the lab for analysis. During the controlling role, the nurse will assess, triage, isolate, and treat the victim and provide public health support for victims and responders. During responding, the nurse will respond to the psychological impact of the attack for victims, the public, and the workers responding to the attack, and may also be involved in critical incident stress management teams and peer-to-peer counseling.